Every minute, an older adult ends up in an emergency room because of a fall that, in most cases, could have been prevented with one simple daily exercise that takes less than 2 minutes and costs absolutely nothing. If you are over 60, the single most important number you need to know today is this. 1 in 4 Americans your age falls every single year, and falls are the leading cause of injury death for adults over 65 in this country. That is not a scare tactic, that is a public health reality verified by federal tracking systems. And most of those falls happen inside the home, in the middle of ordinary moments like stepping out of the shower, reaching for a kitchen cabinet, or turning around to answer the door. I have spent years working directly with older patients, watching the same heartbreaking pattern repeat itself again and again. And I want to share with you the one exercise that changes the trajectory. The reason this matters more than most people realize is that we have been taught to think about fall prevention the wrong way. The standard approach focuses on grab bars, non-slip mats, better lighting, sensible shoes, and removing loose rugs from the home. None of that is wrong, and I absolutely recommend every one of those environmental changes. But research has been remarkably consistent on a single point. Balance training done consistently reduces the rate of falls by roughly 24%, which is a larger reduction than almost any other single intervention available to seniors. The reason is biological, and once you understand it, the whole picture makes sense in a way that hindi wan datsa wans. Mine was obvious. Your balance does not fail in a sudden moment. It erodes slowly, almost imperceptibly over years. 3 systems work together to keep you upright. Your inner ear, which tracks the position of your head in space, your eyes, which tell your brain where the floor is, and something called proprioception, which is your body's quiet awareness of where every joint, every muscle, and every limb is positioned at all times, even when you are not looking at them. Proprioception lives in the nerves of your feet, ankles, knees, hips, and lower back. And like any system in the body, it weakens with disuse. Most adults over 60 spend the vast majority of their day standing on 2 feet, walking on flat surfaces, and sitting in chairs, which means the proprioceptive system never gets challenged. It atrophies, and when life suddenly demands more, like catching yourself on an uneven sidewalk or reaching awkwardly for a grocery shelf, the system is unprepared and the body goes down. What I am about to share with you is not a gimmick, not a fad, and not a 30-day challenge. It is one specific exercise that I have watched change the lives of hundreds of patients. And it is so simple that you will wonder why no one told you about it sooner. The exercise is called the single leg stand, sometimes called the stork stand, and it takes roughly 30 to 90 seconds per side every day, and it directly trains the exact system that fails you when you fall. Before I walk you through exactly how to do it, I want you to pause the video for a moment and think about how you have been approaching balance in your own life, because what I am about to explain in the next few minutes is going to reframe everything you thought you knew about staying steady on your feet. The first thing to understand about the single leg stand is why it works on a mechanical level, because the magic is not in the leg itself. It is in everything that has to fire at once to keep you upright. When you lift 1 foot off the ground, your standing leg has to recruit dozens of small stabilizer muscles around the ankle, knee, hip, and core to keep you from tipping. Your inner ear fires signals to your brain about head position. Your vestibular system adjusts in real time. And your proprioceptive nerves light up like a switchboard, telling your body exactly where your joints are in space. Every second you hold the position, you are training all 3 balance systems together, which is something almost no other exercise does at the same time. Studies following older adults over many years have found that the ability to stand on one leg for at least 10 seconds with the eyes open is one of the strongest predictors of who will fall and who will not, which is why I encourage you to measure yourself honestly before you begin, so you can track your own progress over time. The proper way to perform the single leg stand is straightforward but worth doing correctly. Stand near a kitchen counter, the back of a sturdy chair, or a wall, close enough that you can touch it for support if you lose your balance, but do not lean on it unless you need to. Soften your knees slightly, engage your core gently by imagining you are bracing for someone to lightly tap your stomach, and lift 1 foot a few inches off the ground. You can hold the raised foot slightly in front of you, behind you, or out to the side, whatever feels most natural, but keep it off the floor. Hold the position for as long as you can with good form, meaning a tall spine, level hips, eyes forward. When your form starts to break, when your hip drops, when you start wobbling noticeably, or when you have to grab the counter, that is your time. Switch sides and repeat. Aim for 1 round per side every day, building gradually toward a full 30 seconds per side. If you can already hold 30 seconds easily on each leg, congratulations, your baseline is impressive, and you should challenge yourself further by closing your eyes for the last 10 seconds of each set, which dramatically increases the difficulty by removing visual compensation and forcing the vestibular and proprioceptive systems to do all the work alone. If 10 seconds feels like a struggle right now, that is completely fine and more common than you might think. Start where you are, do 5 seconds on each side, rest, then repeat once or twice. The goal is not to become a flamingo overnight. The goal is consistency, because steady daily practice, even in very short doses, rewires the neural pathways that govern balance faster than most people expect. Now let me share something I want you to really take in, so please pause with me for a moment. The research is clear that balance, like strength, follows a use it or lose it principle that is far more forgiving than most people realize. Improvements begin within weeks, not months, and the body responds to even brief daily challenges. If you commit to this one exercise every day for the next 30 days, you will likely notice that you feel steadier walking across a parking lot, more confident on stairs, and more secure stepping in and out of the shower, which is exactly where we want to keep you. Before we go deeper, if this information resonates with you, share this video with one person over 60 who you care about, because the simplest way to multiply the impact of what you are learning today is to make sure someone you love hears it too. Let us layer in the second piece of the protocol, because the single leg stand is most powerful when combined with one other simple habit that takes about the same amount of time. That habit is what I call deliberate walking. And it is not the same as the walking you already do. Most adults who walk for exercise do it on autopilot, eyes on their phone or their thoughts, walking the same routes at the same pace, which trains cardiovascular fitness but does very little for balance, because the body never has to react. Deliberate walking means walking with intention, choosing surfaces that gently challenge your balance, paying attention to how your foot lands, and occasionally walking heel to toe in a straight line for 10 or 15 seconds as if you were on a tightrope. You can do this safely along a kitchen counter or down a hallway with a wall within reach. The benefit is enormous because you are training your recovery reflexes in a real-world setting, and the small stumble you catch on a straight line in your hallway is the same reflex that will save you on an uneven sidewalk next month. The third element of this protocol is not technically an exercise at all, but it is foundational, and skipping it quietly undermines every other effort you make. That element is hydration, and I want to be very clear that I'm not talking about drinking more water for the sake of drinking more water. I am talking about the specific way dehydration destabilizes older adults in ways that get misdiagnosed constantly. As we age, our thirst signal becomes less reliable. Our kidneys conserve water less efficiently, and many common medications, including blood pressure pills, water pills, and some diabetes medications, quietly deplete the body's fluid balance without obvious warning signs. Even mild dehydration, as little as 1 to 2% of body weight, can produce dizziness on standing, lightheadedness when turning, fatigue in the legs, and slower reaction times, all of which dramatically increase fall risk. A practical target for most older adults is to drink a glass of water first thing in the morning, one with each meal, and one mid-afternoon, adjusting upward in hot weather or during illness, and downward only if your doctor has placed you on a fluid restriction for a specific medical reason. I want to pause here and ask you to commit to one thing before we close out. Pick one specific change from what you have learned today and decide when you will start. Will it be the single leg stand tomorrow morning after breakfast? Will it be heel-to-toe walking during your evening loop around the house? Will it be a glass of water before you reach for your morning coffee? Small, consistent actions, repeated daily for weeks, are how real transformation happens. And the choice you make right now, in this moment, is more important than anything else I will say for the rest of this video. Let me give you a clear implementation roadmap so you do not have to remember all of this at once. In the morning, after you have had your glass of water, stand near your bathroom counter or sink and do one set of the single leg stand on each side, holding as long as you comfortably can. That is it. One set. 30 to 90 seconds total. In the afternoon, particularly on days you already take a walk inside or outside, work in 10 to 15 seconds of heel to toe walking along a wall, then return to your normal pace. In the evening, before bed, do one more set of the single leg stand on each side. That is the entire daily protocol, and you can complete it in under 5 minutes, without ever leaving your home, without any equipment, and without changing out of your pajamas. Now, let me set realistic expectations so you do not get discouraged if change does not feel instant. Within the first week, most people notice better awareness of their feet when they walk, a sense of being more present in their body, and slightly less stiffness when rising from a chair. Within 2 to 3 weeks, steadier footing on stairs and a more confident stride are common reports from my patients. Within 6 to 8 weeks of consistent daily practice, measurable improvements in single leg hold time are typical, and that improvement correlates strongly with reduced fall risk in the research. The hardest part is not the exercise. It is staying consistent during the quiet middle weeks when results are not yet dramatic. And the simplest way I have seen patients push through that phase is to attach the practice to something they already do without fail, like brushing teeth, pouring morning coffee, or watching the evening news. I do need to address safety directly because responsible health guidance always does. This exercise is extremely safe for the vast majority of adults over 60, but there are important exceptions. If you currently use a walker or cane for mobility, perform the single leg stand only while holding that device in place or while touching a stable surface with one hand. If you have recently had joint replacement surgery, are recovering from a serious foot, ankle, knee, or hip injury, or are currently being treated for vertigo, inner ear disease, or uncontrolled blood pressure, please clear this exercise with your physician or physical therapist before beginning. If you ever experience chest pain, severe dizziness, sharp joint pain, or shortness of breath while doing the exercise, stop immediately and contact your healthcare provider. This video is educational and is not a substitute for personalized medical advice, diagnosis, or treatment from a qualified professional who knows your full health history. Everything I have shared with you today points to a single truth that I have spent my career learning over and over. The body wants to stay upright, and given even a small daily opportunity to practice, it will reward you with safer, more confident movement for years to come. The single leg stand is that opportunity, and it costs nothing, requires nothing, and fits into the busiest life. If this video helped you, please like it, subscribe for more practical health guidance, and share it with someone whose steadiness you want to protect. Start tomorrow morning, stand on one leg near your kitchen counter, and discover what your body is still fully capable of doing.